Good morning, friends. This is Gail Strack, CEO of Alliance for Hope International, and I'm joined today with Patricia Bauer. This is our do-over. Yes, we are doing our webinar all over again. Patricia tells me that most of you who attended that first one, you're on the call here as well, with a couple of exceptions. So that means what we're going to do is just highlight what we've covered before and get right to our discussion about partnerships. And I've also added a couple of questions about recruitment of partners, working with partners part-time and full-time, because I think as we're working with new family justice centers across the United States, that is a challenge for them. I think all of us know when you have everybody there full-time every day, it's just magic. And the challenge is when our partners are there part-time, but those challenges for them are definitely real. So what we're going to do is just plow through our, as you know, our staff. They're amazing. We love them, adore them. We'll go on. And of course, we are so grateful for OVW and their sponsorship. As many of you know, this particular webinar is our keeper. It's our way to continue to have that learning exchange. We value our partners and we value our guiding principles. They almost go hand in hand. And for this particular webinar, relationship based is the heart of it. We also want to remind everybody to sign up. We're getting already a lot of folks who are signing up. We're going to have a pre-conference. We'll be thinking that through very carefully. So anybody who wants to participate in our thinking meeting, just let us know by sending us an email. But this particular year, we are going to reach out to our international friends and see what we can learn from them and vice versa. And then right now, we just want to quickly find out who is on the call. So we will do roll call. What should we say? This morning at our weekly meeting, we asked everybody to share one word that they were feeling. I was feeling like I was in a full sprint, but excited about it. Okay.
Yes, so it looks like we still have some people joining. So I will just go down the list and try to catch up as we go. So Alexis Swanson, I want to start with you. And just, I know some people may be joining using their computer audio and sound for the first time. So just want to make sure that's enabled. And if you have any background noise, just try to mute yourself on the GoToMeeting control panel. So with that said, Alexis, I will start with you. Looks like Alexis is also having trouble with some sound. Paul, let me go skip down to you.
Hello.
Some background noise. Give me just a minute. Okay. Paul, it looks like you were logged in twice, so that could be why you have some background noise. So I have you logged in 2 times, so you may need to disconnect from the call and then try logging back in again. So I will move down the list to Amber. Are you there, Amber?
Can you hear me?
Yes, we can hear you.
Hi. I missed the opening, what we're saying. Sorry.
Just tell us your name and your center and one word that expresses how you feel today.
Oh, okay. I'm Amber Hong, and I'm with Clackamas County Sheriff's Office and the Oregon City Safe Place Family Justice Center. And one word is hopeful.
Awesome. Thank you.
Nice. Thank you.
It's also a voice check.
It is. Yes. So Kevin, are you there? Kevin Mayer?
Yes, I'm here, and I hooked up a microphone, so can you hear me?
We can, yes.
Good. Okay. Yeah, so my name is Kevin Mayer. I work over here at the Family Justice Center in San Diego. We just in the domestic violence police department side together. We're transitioning actually 5 to 6 months in the city attorney. So I guess my word would be excellence.
Great. Thank you, Kevin. So, Tony, I see you are on the call. Tony, are you there? Tony, it looks like your sound may not be hooked up. Denise McCain, are you there?
Yes, I am. Can you hear me?
We can, yes.
Hi, I am here in Prince George's County, Maryland, director of the Prince George's County Family Justice Center. And I guess for me, a word right now would be anxious.
Anxious. Ooh. Hopefully we can dive into that a little bit more on this call. And hopefully provide some support.
That would be great.
Wonderful. So Alexis, have you been able to figure out anything with your sound? It looks like Bill Hernandez, you just joined the call.
Yes, I'm here. Hi, everybody.
Hi.
We're still developing, and I'm not sure what this word that you're looking for is right now, but what was the question?
How do you feel? The one word that describes how you're feeling today. We've got hopeful, we've got excellence, we've got anxious. Mine was a full sprint.
A little stressed right now. Starting a new position as a full-time domestic violence detective at Napa PD. So we just finally got that on board. So yeah, a little much right now.
Okay, thank you.
And congratulations on that.
Thank you.
Yeah, wonderful. So it looks like Mary Hootsma has been able to join us, but she it doesn't have a microphone hooked up, so she is going to participate using chat. So Mary is with the Essex County Family Justice Center. And Mary, if you want to chat your word that describes how you're feeling today, I can share it with everyone. And Paul, so Mary, why don't you chat your response? And then Paul, it looks like I'm just checking in to see if you've been able to resolve your sound.
I hope so. This is Paul, Sacramento, California Family Justice Center, and I'm happy. Things are coming together, and we're opening our Family Justice Center next week.
Wow, awesome. Congratulations.
Yes, wonderful. And so Mary has shared that she feels like she's herding cats right now and has lots going on. So hopefully that's a good thing. And is there anybody else on this call that I haven't called on yet?
Hi, this is Abigail. I'm calling from the Thurston County Justice Center here in Olympia, Washington. And the word I would use is empowered.
I like that word. Thank you.
And it does look like we have a Deidre who just joined the call as well. So Deidre, are you able to share with us? So it looks like we may have a few people who are still working out kinks in their sound. So we did, I know I've been getting some chats and questions. So we have changed the people's ability to access this webinar over the phone because we had some issues last time. So to try to resolve that and prevent that from happening in the future, we have just allowed for this call or trying out just doing web-based access. So I've gotten some feedback and we will try to figure out how we can kind of resolve our technical issues and still give everybody access to the call. So thank you for bearing with us while we try to come up with some solutions and try new things.
and just for like extra insurance, we discovered that putting us on hold is not a good thing because it impacts everyone. So if you do need to take care of something, please do, because we know that there are fires at family justice centers all the time and you got to take care of that. But on hold has an impact here. So we're going to plow through because as many of you know, the reason we are getting all of you together now is that we want to go back to Dream Big, Start Small. Dream Big, Start Small is the second book on how to start and sustain a family justice center. The second book was really a work of heart, a lot of heart and hard work went into it. What I like about it is that when we wrote this particular book, it was really the product of many of the directors who were open at that time, who made the time to join us on calls, and we would just pick their brain. We could also set up individual phone calls to pick your brain even more. But the next book is going to be a product of all of you. So this will be like the third generation. And of course, the third generation of how to do this is always better. We are now focused on chapter 5, which deals with partnerships in a family justice center, and also what we're calling multi-agency models, those centers that don't meet the full definition of a family justice center because of our affiliation. So, good. That was just like a test. My heart stopped for a minute there as I heard a lot of background noise. Last time we were on the call, we kind of reflected on this, the process of bringing together a broad cross-section of supporters to address family violence in a community is partly political, partly social change, and most clearly a process of recruiting allies who share the common goal of healthy, nonviolent families. What was so funny about this particular quote is neither Casey or I remember who wrote it, but what I do remember is that there is always like a secret ingredient that we can all bring. And I think it is part political, part social change, and also trying to now integrate at a family justice center. We talked about why partnerships matter, which I think all of you would embrace each and every one of these particular, I think, themes that Patricia had a chance to reread this chapter and pulled out these things that really landed with her. I think what landed with all of us in the last call about strong partnerships definitely produce hope. And Casey is currently not joining us today because he's on his way to Montana, and he just finished his new book on Hope Rising. I've had a chance to read it, and it is amazing. And I think it does transform you. I feel like I'm almost a different person as a result of reading that book. Why partnerships matter, and we talked about the trauma-informed framework, especially now since we've been doing so much work with our OVC grant, talking about polyvictimization, and one of our partners has to do with SAMHSA and folks from who are writing the book essentially on trauma-informed practices. And in our OVC work, they're really thinking through what does that really mean? Because I think all of us have heard the term trauma-informed care, trauma-informed services, trauma-informed. And then after a while you go, well, what does that really mean? And how does it become incorporated and integrated in a family justice center? And then we talked about the challenge of conflict and change. And I think for those of you who have started a family justice center or in the process of starting a family justice center, buy-in is definitely that first chapter, but the next chapter is when people say that they're all in, what does that mean? And what does real collaboration mean and integration? And then, of course, we spent a little time talking about communication and how that is so important. And all of this is about our relationships. So before we go into, I'm going to back up because one of the questions that has come up in our work with other family justice centers is how did you guys all go about recruiting your partners, especially those who are all in and those that maybe, I'm not sure I'm all in. I like the concept of a family justice center, but maybe I'll just be there part-time. So how did you deal with those potential partners who said I'm all in, or those who said part-time for me only? Because I do think part-time on-site partners creates a significant challenge to victims. And being at the Family Justice Center most recently, it just breaks your heart when you have to tell a victim that, yes, we can provide this service for you, but you're going to have to come back on a Thursday to see that particular partner. Okay, so are you ready, Patricia, to open this up for conversation? I think both of us, our little hearts are beating a little faster than usual.
Yes, and I know a lot of people are struggling to access their microphone and computers, but Abigail has found a phone number that has worked for her that I didn't know was available. So it's good to share information. So Abigail has just shared a phone number in the chat box for those of you who are having trouble with sound and communicating just online. So you can try that phone number that she just provided. So With that being said, I know some of you are doing just fine with your sound, so maybe we can, I'm comfortable starting and seeing who can chime in, and then hopefully other folks can join in as we move forward.
Okay, so who's our first director who wants to share? Maybe we should go with Happy. Paul, who is happy.
Okay, that's what I get, huh? One of the things that I've done, kind of, I'm project manager before we actually open, and there are a number of community groups that sometimes work really well together, and sometimes there's competition for funding and creates issues. So what I do is I am asked by many local community groups to go out and give talks about domestic violence, human trafficking, elder abuse, things like that. Like, we are going to put together a seminar on elder abuse and prevention tools for elders. So what I do whenever I have a program like that, I always go to my partner agencies and ask them for a wish list of things that they need, and also a list of services that they provide, so that I am always communicating to my partners, I am working for you when I am out of the community. And that helps, I think, the partnership. It makes partners realize that we're not just asking something from them, we're actually giving them something back that's beneficial.
Oh, I like that. Anyone else want to jump in and share? Okay, well, let me just focus in on the family justice centers that have part-time partners. Can you share some of your lessons learned with part-time partners?
So this is Denise. Can you hear me?
Yes.
We have a number of part-time partners here. I would say that they're here on a part-time basis, not because of lack of buy-in. It's really been resource-driven, that they've not had the capacity to have staffing here on a full-time basis. Most recently, I submitted a grant to provide resources for the to have full-time staff. Is that me?
So Denise, we are getting some background noise, and
I don't know why. I don't have anything on.
or maybe reverb.
Yeah, it's still doing it, huh?
That's better.
That's better. It wasn't as bad as before, but let's just keep going because.
Okay, so essentially what we ended up doing was an advocacy model. And what we quickly discovered is that there was some overlap with some of the services that providers offered. So I created a schedule with services and made sure that while some could not be here every day, I made it so that those services were available every day. So it was a way of sort of filling that void by looking at who else could do some of the same essential things that others do. Because we have over, 15 nonprofits in here, and of that, only 3 are full-time. So we were able to address that. The other thing that I think is really important is, as was stated, is to make sure that partners understand that you're here to work with and support them, which was why I said I submitted the grant for funding for other agencies so that they could get the full-time support.
Nice. Well, I think that is very good advice. And
one other thing, Gail, I'm sorry to cut you off because this was my main point that I wanted to make. We did a needs assessment with regard to how do you determine which partners you bring on. We looked at where the gaps were and actively sought partnerships from organizations that were able to meet those needs, and then went through even a vetting process with the other partners to ensure that they were the right fit, because we're a very close-knit group. We work well together, and it was important not to just bring anybody into the mix, but it was someone that everyone felt could work together in a collaborative manner. So I thought that was important to add to the discussion.
Thank you. And I do think that's one direction Paul was sharing about partners working together and some don't, and how do you vet them and balance that at your center. So that's very helpful. Thank you. Anyone want to add to this, or we can go on to probably the tough one when you reach conflict?
Hi,
This
it's Mary from.
Oh, Mary?
Yeah, I got in on the phone line. So I just wanted to, share. We too have part-time partners, and that was initially for some agencies because of resource limitations. We worked together to identify funding sources so that they could increase their capacity. Over time, we have a civil legal organization that has significantly increased their capacity. So sometimes that's really just how you have to start. That for us, that was how we had to get started. We were motivated to increase that capacity because we were getting input from survivors that we needed more civil legal service. So I think that fits with start small, dream big.
Mm-hmm. That's perfect. And I think you do. You got to start somewhere and build from there. So it's great to see that your partners have increased their presence. And it's making me think too about the strategic planning that we do with our partners. And for those who do start off part-time, what is the director's responsibility to keep that at the forefront based on what victims need and the services that they need? Very nice. This is very helpful. Thank you. I think there is one other person who's going to share some learnings about partnerships, partners on site.
This is Catherine in Guilford County, North Carolina. And we found that there were some partners when we opened who wanted to provide part-time on-site services. And frankly, once the center was functioning and going, and because they weren't here every day, really, and coupled with clients coming in and not being able to immediately receive that service, they ultimately became an off-site partner instead of an on-site partner because it just made more sense. Particularly in a high volume center, we need services readily available. And our goal is, while people can come back as many times as they want, we want to try to make sure we have everything accessible the same day that they come. So while we appreciate part-time assistance, that just hasn't worked really well for us. And like some of the other folks have said, we've worked strategically around some grant funding and some ways to help people equip themselves with resources to meet the need on a daily basis versus a one time a week or is that on an on-call rotation.
Thank you, Catherine. It's good to hear your voice. I didn't know that you were on the call. So let me ask you a little bit more. You said high volume. What is your volume now, and how many full-time partners do you have?
So on site, we have 60 professionals who are here full-time, representing 15 different organizations, and we average about 40 plus walk-ins a day.
Wow, that is definitely high volume.
I don't know if that's high volume, but it feels like high volume to Sonia and I. Sonia's on the call. We're both here together. So we started out with about 12 people per day when we opened 2.5 years ago. And it is definitely, it regularly exceeds 35, 40 people a day.
Well, it sounds like you've opened up a really good restaurant that serves really good food, and there's a waiting list.
That's right.
And it's interesting when you have that workload, you're part like, oh my gosh, it's overwhelming. But the other part is, thank goodness they're coming in and getting those services. So thank you, Catherine. That was really helpful. Anyone else on the call that wants to address this issue? Okay. Well, then let's go on to the next one that's covered in the how-to manual. What have you done to negotiate conflict with partners? Do you have a process for conflict resolution? How do your partnership agreements help when conflict arises? And I think the bigger one too, that is partnership agreements. Mm-hmm. Many of you know, we started off with a model called a partnership agreement. I think many of you adopted the sample and or added to it. So in fact, let's talk a little bit about partnership agreements. What has worked? What have you added or fixed with partnership agreements? And do you think that they are still important? Okay, looks like I'm going to have to jump in and pick someone. Let's see. Trying to think of who's been open a little bit longer. Let me ask it this way. Is there anybody on this call that has an open FJC that does not have a partnership agreement? Okay, so everybody has one. So I'm going to go to Mary, because Mary, we've been working with you probably the longest, and you've probably dealt with a lot of partners and partnership agreements. What have you learned from the utilizing partnership agreements? Do you have any do-overs or advice to new directors?
This is Abby from the Family Justice Center in Olympia, and I'm happy to weigh in on this since it's feeling kind of quiet. I'm in the process of drafting some new partnership agreements, MOUs, for some new partners, and a lot of ours are a couple years old from when we first opened. And so I'm eager to hear what people might have added that are new, just to sort of get, I know I can check the library, but just to hear what people are doing now, if there's anything that they've included that's been really useful, especially integrating a new partner who might not know sort of the goals that we have.
Well, I will say, because I'm now reviewing some partnership agreements, is that, and there was definitely some do-overs. I think for me, my do-over from the first partnership agreement or generation would be really sitting down every single year with your on-site partners and talking about those partnership agreements and finding out what really worked and kind of what needs polishing. I think it really does come down to the partnership agreement to make sure that they are a fully engaged partner. I think that would be my biggest one. And I mean fully engaged is those partners who attend the meetings regularly, who are part of your ongoing strategic planning process, who commit to being engaged and sharing those statistics. Because as we know, all of us have a duty and responsibility, and with grants, we've got to get those statistics in. And having those statistics in on a regular basis is helpful. I also think that a commitment in watching the Ellen Pence video, she always stretches that point, is that when somebody says I'm in and they're willing to co-locate, that they need to be willing to do more than just co-locate and live there. That they're willing to have a conversation about integration and how we're all going to transform the way we've been doing business, because the goal is not to do the same thing we were doing it before, but just doing it all like co-located at a family justice center. So I do think partnership agreements are really an opportunity to think through what is the meaning of a fully engaged partner. And as I was rereading the how-to book, Dream Big, Start Small, Sergeant Robert Keach, who was very instrumental in the San Diego Family Justice Center and helped build the volunteer program, he created a pledge for all the volunteers when they took their training, they took their tests, and they were welcomed into the Family Justice Center. Their pledge was about being a really good, dedicated, trauma-informed volunteer. And I know we've talked about this kind of pledge with some of the directors on this call, but I teased about it, but I'm now ready to really think it through. There should be a similar pledge about being fully engaged as a partner, because the saddest thing that I've seen when I've worked with family justice centers is that they're all located in a beautiful building, but they're siloed and they're not really working as a team. So I think those were the big lessons learned for me. I do think calling them partnership agreements is a nice approach, because it does say we're doing this together as partners.
Mm-hmm.
Thanks, Gail. That's really great.
And I did get a chat from Susie, who's still not having access to sound. So she said that in her sense, she's with Rose Andem Center in Denver. And she said related to conflict resolution that they, in addition to partnership agreements, they have multiple meetings to resolve any conflict that comes up, and that their center is actually working to firm up an operations committee, which would be the central place to address any conflict. So it's a formal committee that would be able to handle any, I guess, formal conflicts that come up and be responsible for conflict resolution.
I think that's good. And I've seen conflict resolution language in most of the operations manual, what we're going to do. And I think for me, the biggest lesson learned is always directing people to make sure you talk to that person you're having a conflict first, as opposed to running to the director and kind of sharing things behind their back. That was definitely a keeper. I did find as a director, and we just incorporated here at the Family Justice Center now, is that we borrow from the police department, because I noticed that when the police department had like their daily meetings, really trying to just talk like that's part of their generation, and they have these meetings, and they're telling the next shift that's coming in what happened. Everything would kind of run smoothly. So we started the 15-minute meeting at the Family Justice Center, just saying, what worked yesterday, what needs polishing, who was here, and who needs kudos. Somebody who went out of their way to really do something special that we need to acknowledge. And being back at the Family Justice Center, I go, that was really good what the police department does. And we've been doing it now for the last several months. And Patricia, I'm going to put you on the spot, but do you want to share what the 15-minute meeting does for you and the staff?
First, it lets you know who's in the office, so you know if someone's there, someone's not, and it's just a chance to talk about, make sure nothing gets missed. So everybody has a lot going on, a lot of things on our calendars, and they all intersect. And so it's just making sure people know if you're supposed to have a phone call together or a meeting, a chance to brief on that. If anything came up the day before that there is a solution for that we can kind of chat about quickly and resolve, then we have a chance to do that. And then, like Gail said, it's a chance to give kudos to people. And this could be anything from you did a great job on a formal work project to just something that's happening in your life. So I think it's been a really good relationship building thing for our staff to just get to connect with each other briefly. And there are some mornings when we don't want to leave our little meeting. We just want to sit there and keep drinking our coffee together. So I think in addition to just helping the flow of our office, that relationship component has been a big takeaway also.
And I think what I have found then and now is that if there are issues percolating, which can turn into a conflict, is by having that morning meeting, it surfaces and you can address it, as opposed to like it percolates for that whole month until you have a community partners meeting. And then that little thing can really be this hot pot of boiling water and someone is really upset. So I'll share that just to kind of get the conversation going. But any of our friends who want to share how you have managed conflict and our partnership agreements, that's still open at the table.
This is Suzanne in Tulsa. Can you hear me?
Hi, Suzanne. Welcome.
Hi. One of the things that we've tried to do on a regular basis, and what I've tried to do since I've been here at the Safety Center, is that we position ourselves as that neutral third-party intervener in these kinds of situations. And so if someone has an issue with somebody that they can't talk out and they want to file a grievance against another partner agency, or we become that clearinghouse. We counsel both parties. We suggest that they try to work it out. If they can't work it out, then we convene the larger group, and if a larger group is involved, and come to some consensus about how to resolve the area. If there's no consensus that can be reached, the group decided that the executive director position would actually be, to quote our former President Bush, the decider. And so we've not had a situation where that's arisen, where I've had to perform that role. But we have had occasions where partners will agree to disagree, but we continue to move down the road together and come up with other ways to solve the issues. So that's just a little bit of experience on our side of the fence in terms of how we work with our partners.
Thank you, Suzanne. Do we have some others? Let's see, who said that they were stressed and or anxious? Well, Denise shared before. I don't know, Denise, is there anything else that makes you anxious when it comes to the conflict or partnership agreements?
No, not with that aspect of things, no. I think we have a good system here and we meet regularly and deal with things right away.
Okay, so I hear meet regularly. I would have to say meeting. And once I realized how important this was, it's almost like if you want to err on the side of communication, err on the side of over communication, going out of your way to communicate with people, because sometimes it was that lack of communication that led to the conflict.
Absolutely.
Okay, well, we're going to still push forward. How do your partners and staff build relationships and bond? What do you do just to be kind and have fun together? What you're looking at now is our staff. We decided to have a really fun day together, and because we live in San Diego and we've got boats, we tend to go on the water, rent a boat, and have a good time. And lately, the gals are singing camp folk songs, and they just kind of start singing just about anytime, anywhere.
So Susie has shared that they have potlucks on a monthly basis at the Rosanum Center and roundtable discussions as part of their informal and formal activities.
Anyone else?
Hi, this is Amber at the Oregon City Safe Place. And we also do a monthly meeting where we provide lunch and speakers or just an opportunity for people to share successes with their participants. And we did Secret Santa this year for Christmas, so that was a lot of fun. People had a really good time picking out gifts for each other and that kind of thing. And then we've also started doing a Monday morning message. That's what I call it. Just to keep everybody in the loop and kind of try to include fun things or, kudos and things like that in it. So those are some things that we do to try to keep everybody connected and on board.
I like that. Kevin, I know if you're still on the call, do you want to share what you did? You're a new FJC director and you had some events in December to keep those spirits up, especially with all the DV detectives.
Yeah, well, this past holiday season, we had a party we had Santa here. We invited a bunch of families, victims, along with their children. They came, and I think we had over 150 children that came through. They were giving gifts. Got to get their picture with Santa. We also had a party with all of our partners and our law enforcement. It was a Christmas party and also a potluck and a gift exchange. We had in the potluck, there was also a sweet. People brought in sweets and they were judged, and so we got awards. It was kind of fun. We also have monthly meetings to meet with all of our community or all of our partners to discuss ways that we can improve and continue to advance our goals. And then we frequently have communication. I'll just drop by and talk with them or they'll come by, and if there are any conflicts, we'll have to meet to resolve those.
Thank you. And I do sense a really nice spirit there. So good job, Kevin. Let's see.
We have a donor here in Greensboro who would prefer to remain anonymous, but we're a government-run entity, so we don't have flex dollars like a nonprofit would have. And so one of the things that they've done is paid for as many people that want to go to a downtown baseball game. We're located downtown. They've covered that cost. They've covered pizza lunches. They bring in treats. They had mugs made with our FJC logo and purchased them for everybody. They did little cards that say "Together We Rise." So about every 2 months, something special arrives, and I'm the only person who knows who the person is, just so I can coordinate the gift. But it's for anybody who works on site, and they include our interns and volunteers. And sometimes it's a little bit more costly, and other times it's pretty low cost, like what everybody's favorite candy bar was and coffee drink. And they gave gift cards and candy bars. And I mean, people have really seemed to enjoy that. It's a little thing and it comes from an external source, which I think is also a value versus just me as the FJC director promoting community. Like, we get to experience that as well as like get to kind of be a participant versus the driver of that. So it's just been a really nice thing for us.
Thank you, Catherine. And I think you said a word too that I think we got to include, Patricia, is we've talked about developing a community for our survivors, but what we're really talking about is developing a community for the partners as well. So thank you. That is amazing. And your donor is going to remain anonymous, huh? You're not going to share that one with us?
No, we had to, do a full-on promise. So, which I think is really cool. So, it's been a real good thing. And I think I like that word community because I think so often, and frankly, I'm intentional about this with my staff, is that sometimes FJC staff need to be appreciated too. Not just, we work really hard to appreciate our partnership, and making sure that we too get that sense of appreciation, I think is really valuable in this work as well.
Oh, thank you. My spirits are lifted just seeing those days when all those things are happening. So thank you for sharing that. Anyone else want to share? Otherwise, we will go on to the next one. Okay, so nobody gets dunked, like dunk the FJC director. So now I'm thinking like crazy creative things that people might do. All right. We might have to have a separate conversation, maybe over adult beverages, to get the other stuff out. We're going to go ahead to the next one. And the next one we want to talk about is, how often do you hold those meetings with on-site partners? We kind of get a little sense, but there's like a long list of partners, or I should say meetings that we need to have. So we've already talked about community partner meetings, which is definitely a must. We've talked about a daily check-in meeting. We've talked about an operations meeting. We know, like at the Family Justice Center in San Diego, they have a steering committee meeting with some elected officials to check in. What else do you folks have as far as meetings to keep everything running?
Hi, Amber again. We do steering committee meetings. We try to do them monthly, but oftentimes it's hard with the scheduling. We do operations committee meetings every other month with just each partner agency's supervisor or lead worker. And then we do our monthly all staff where everybody's invited. So we do quite a bit of meetings here.
Very cool. Anyone else? Let me try to think of.
Gail?
Yes.
This is Mike Burke. We used to do, when I was director of the Shasta Family Justice Center, we would have monthly, well, not monthly, but often we would have grant meetings where we would come together and talk about different grants that were potential with the lead agency leads.
Okay, that's a good one. It can be a difficult conversation sometimes, but a very good one.
This is Abigail again from the Thurston County Family Justice Center. We do a weekly huddle, sort of what you described, that 15-minute meeting. We do that once a week on Tuesdays, where most of our partners are on site, including our part-time partners. So for me, that's a good way to tie in the part-time partners. We also do a monthly operations meeting, a monthly leadership meeting with our lead partners. And then we also have our CCRT, our Coordinated Community Response Team meeting once a month.
Okay. Anyone else? So I think consistent with the CCR, I know some family justice centers have a kind of like a high-risk team meeting when a victim comes through and you identify somebody with a high score and at high risk. Some will do those high-risk team meetings just naturally and on the spot. Others have scheduled a meeting once a month to go over those cases. I also know that some have clinical meetings because that intake process can be very challenging, and you really do have to have like a synchronized swimming team. So when a victim does get welcomed to your Family Justice Center, what is that process going to look like, and how can you have your intake within 15 minutes or less from somebody walking in the door, and then provide services within that time. So early on, because I wasn't a clinician and didn't understand a lot of these issues, we created a clinical team that helped us walk through what are we going to do if someone is suicidal, what are we going to do if there's mental health issues, and just down the list, creating all kinds of scenarios, and also determining who would be qualified enough to do an intake. So it's not just any volunteer that walks in the door. We also did, when you have a bigger group, we did the orientation meetings, making sure that anybody that walked in knew, whether it was an intern from our organization, a new detective, a new prosecutor, that they would go through an orientation to know about the operations manual, to know about some really key things about confidentiality. So this way no one would be caught in an awkward situation just because they just didn't know. And then I think the other one we did was volunteer meetings, one during the day and then one during the night to make sure that all the volunteers. And then it was quarterly appreciation meetings, where at that time, every quarter we would have the elected, whoever is your lead agency, whether it's a DA-led, police-led, government-led in whatever form or nonprofit, is all of the key leaders and supervisors would come back and we would just appreciate each other. Every category, somebody was identified as what they did to go above and beyond. And it was a pretty cool thing. We also had volunteers who made the best barbecue in town, and you could smell the barbecue. And if no other reason, that was probably the best and well-attended meeting because the barbecue was so good. So those are the ones I remember. And I also just kind of thought about our New York friends. Our New York friends from Brooklyn, they were averaging about 1,800 clients per month and had about, I think Jennifer DeCarly told me, almost 60 partners on site. And she said she had to have all these meetings that we talked about, usually twice, just to make sure she communicated with everybody on site because of everybody's schedule. And it just seems so daunting, but I think it worked because they had so many partners, and over communication was her core principle as well.
And I just wanted to jump in about the clinical meetings. And I know there are both the New York Family Justice Centers and the New Orleans Family Justice Centers currently have a program where they are working with psychiatrists to just have meetings with frontline staff to talk about specific cases and then provide training at these meetings. And the results in both of these places have really been that the people who are doing that intake just feel more comfortable, are going to their supervisors less because they're just getting equipped with more resources and tools up front, and are just able to really not be scared to ask them questions that before they might have been uncomfortable with around mental health, suicidality, and then as a result are just providing better support for the survivors. So I think that we've just really been seeing in those centers that having an opportunity for frontline staff to have a meeting with someone who is trained to address these issues that we know come up with survivors is really just helping that intake process run more smoothly, both for the survivor and for the frontline staff.
And a lot of this information too is coming out of the Family Justice Centers who are working on the OVC initiative, which we're all going to benefit from. They're really focusing on the poly-victimization. And I think, Suzanne, you're one of our OVC sites. And as a result of some of the feedback that we received from them, we are listening and we are doing. So one of the upcoming webinars that has been requested was a webinar on strangulation for frontline workers. And in particular, we just reeled in Dr. Jackie Campbell, and Dr. Jackie Campbell agreed to be part of that webinar. And what we're going to kind of do, and I'd like to have your feedback because we'll be planning this, is to kind of take it from the intake perspective. So what do you do after you use the danger assessment tool and you identify a victim who's been strangled, and it may have happened just recently or it could have been months later? What does the front desk or the intake worker or anybody who comes in contact with the victim who's been strangled? So she will be sharing some of her new tools. Many of you know she's got the danger assessment 20 questions, which I've always liked, but I didn't like question number 20, which deals with suicide, because while it's helpful, I also wanted to use some of these tools in court and with all the partners. And you don't want to get that 20 question, the question number 20 about suicide, to everybody's attention. But I like DA11, which most police agencies are using. And now I don't know if you guys have heard, but she's come out with DA5, which is just 5 questions. So in a very tough situation where time is limited and we're thinking about quick intakes, I think that DA11 could be a very useful tool. And I'm also finding case law that now allows for the introduction and use of the danger assessment tools in court, and even found an article that identifies the tools, these DA tools, to be used in court as a best practice. So that way, everybody, not just the folks at the Family Justice Center and all the on-site partners, have the same language about high risk, but the courts do as well. So given those comments, any reflections or suggestions, anything that should be focused on?
This is Suzanne again in Tulsa. We came up with a very simple way to handle our strangulation victims. We have a very high rate of that here in Tulsa. And one of the things that we do, we're fortunate that we have forensic documentation on site, but we also have SANE nurses on site and some medical assistants. So as part of our intake process, when a person initially presents, they complete a very brief 10-question health survey assessment that really informs, it's really the first thing that they do. And if they say yes to one of the first 4 questions, which includes strangulation or attempted strangulation or choking, and we define it for them, it includes pregnancy, it includes bleeding, and it includes difficulty breathing or chest pain, they immediately go to the nurse. And our nurses, Kathy Bell is in charge of our SANE and forensic documentation program, and she's a very, she's a consultant, and I think she's engaged with you, Gail, to some extent on the strangulation.
Yes, she's on our advisory team.
And they're the first stop for our victims. Now, what our law enforcement agency has started doing as a result of this is that the chief has now approved policy for Tulsa Police Department, first responders, and we have developed a trifold leave behind for all officers responding to 911 calls who actually leave this behind with the, are told by policy to leave this behind with the survivor. And as the police report is filed the next day, we actually have an advocate with the police department who follows up on every alleged strangulation incident victim on those police reports and encourages them to come in, talks to them about strangulation, what it means for their health, how they can be examined, and how we can better provide safety for them over and above whether or not they decide to get a protective order. And so that has gone into place, and we've had 47 additional victims who have presented since we started the program in April. And we've actually had 3 that we have sent to the emergency room from here. And we actually had a victim present as a result of that call who had a stroke on site. And we were able to get her, because she came in, we were able to get her to the hospital very quickly and get her taken care of. So we've tried to be very proactive in how we're approaching the whole strangulation issue as not just an indicator of future homicide or mass shooting or cop shooting, but also as serious health issues in the long term for our victims, and are trying to kind of get ahead of the curve a little bit.
Wow. Okay, well, I'm going to be calling you back. This is amazing, and yeah, I might just recruit you for this upcoming webinar, Suzanne. Thank you.
You're welcome.
Okay.
But I tell you, the strangulation protocol actually came from our family violence unit sergeant in the detective unit. He's the one that said, why don't we see if we can get the chief to make this protocol official, and then we don't ever have to worry about it. And he took it to the mat, and he did.
That sounds awesome. Well, I definitely want to get more details on that. That is definitely a promising practice. And the fact that you had a victim have a stroke on site really raises that issue. We've had a number of those cases across family justice centers, and I think that's why everybody's asking for, okay, let's really focus in on exactly what we can do. We will be calling you back to find out more so we can share as part of this upcoming webinar. To keep going forward, we really like from prior calls that we've had when we learned about some of the partnership surveys that some of you have done and you have shared with us. So we want to thank you for that. We know that our friends from North Carolina, Catherine and Sonia, you do one of the HOPE scales. And then we learned from our friends in California that they do annual partner surveys to find out how they're doing and if they're improving. So let's spend a little bit of time talking about this while we have a few minutes left, because I think this is definitely key to our success and good relationships. So maybe I'll start with Catherine. If you're still online, can you share a little bit more about what you do with your partners to find out if everything is going well and hope is rising?
So this is Sonia. Catherine actually had to come off the call. One of the things that we're doing is we actually walk around to each partner that's in the Family Justice Center and talk with them, ask them, you know, what's working for them, what are things that have happened throughout the week that could have worked better. And again, we do talk a lot around hope. You know, we haven't done a hope scale in, gosh, I want to say about 6 to 8 months, but certainly we'll be administering that probably in the next little bit here.
Okay, great. And anyone else on this call that uses a partner survey, either annually or at some point in your partnership or at your Family Justice Center? Okay, so what we are going to do related to this is we are now reaching out to all of our FJC directors and pulling all existing surveys and exit surveys that people are using for survivors so we can update our packet and get that out to everyone. We're also improving our snapshot process. We'll be having a big think tank with our team. We've got Rebecca Lovelace who's going to be in town, so we're going to pick her brain. And if anyone on this call wants to kind of help think this through, we'd love to hear from you, because we'll be improving that snapshot that was created almost, 8 years ago. And then I think our very last one is, what are ways that you promote shared decision making? Shared ownership. Like, we are in this together. For those of you who are still in the call, and we got 2 minutes left, because we want to pick your brain. Okay, well, I think we've picked their brain. Then I'll just go to any final thoughts or comments that you want to add. And you can also email us to say, I've got more to say and share with you, and we will set up a private call so we can include all of those learnings. So any final thoughts, challenges, successes, words of wisdom, things that you want us to make sure that you can send your love into the future with our future Family Justice Center directors? Any keepers? Any do-overs? They're hungry. I think they're hungry and they're ready to end this call. So I'm going to take that as a clue. And let's just go ahead and end for the folks that are here, that you can at least give us one thing or one word that you've heard in today's call that you're going to implement your center life. But ooh, that sounds good.
So this is Sonia.
Abby. Oh, go ahead.
Okay, we got two. Yay, Abby. We'll go with Abby, and then we'll come back to Sonia.
Okay. This is Abby. We are having a partnership award, which I'm excited about, to honor an individual for their work last year. But I like the idea of trying to incorporate more team building and more fun culture for our team to be more integrated. So thanks for all your great ideas.
Okay, great. Sonia?
So one of the things that I heard during the call, I think Patricia was talking around this, as far as just like that 15-minute meeting that you have, where you all come together and just kind of, it's informal. Catherine and I were talking about that, and that's something that we would want to implement. And not only, and maybe on a Friday morning, we would implement that, just kind of talk about the week's numbers, what it looked like here at the FJC, who went above and beyond as far as some of the work here, and then any trainings or anything that are coming up in the next week or in the next couple of weeks, we could discuss that.
Cool, thank you. All right, time for one more, and then we'll call it a wrap. Bill Hernandez, I'm going to lean on you if you're still on this call. Since you were stressed, hopefully you feel less stress.
Yeah, no, I'm feeling fine. It's just a lot of work implementing this new position and still trying to work on developing the Family Justice Center. I did enjoy the community portion, and one thing I want to say that it was a success as of late is that I think that when you're having difficulties with some problem or some partner agencies, maybe bringing them into the fold, that maybe get contact other directors and ask them specifically what they did, or have them actually talk to those people in order to encourage them and to get back into the fold as far as following or coming into the Family Justice Center process. So that's one good thing that happened recently at the Directors Conference in New Orleans for me.
Oh, that's great. And I do think the Leadership Institute is a keeper for us. It is really great when we all get together and share those experiences and learnings. Well, friends, this is one of my favorite meetings or calls of the month, and it was great to hear everyone's voices and your suggestions, ideas. And we'll keep having these calls, and then soon we will start into writing and getting a new book out. So Happy New Year, and be safe out there. Thank you.
Bye, everyone.
Bye.
Bye.